So what is irritable bowel syndrome, often known as IBS? What are the symptoms and what causes it? And does diet play a role in irritable bowel syndrome? If so, how can I use my diet to find relief? April is IBS Awareness Month, so what better time to take a closer look at this condition that affects up to 1 in 5 of you. In today's video, we will take a look at IBS, its causes and its symptoms. And at the end of the video, I will help you to piece together a list of information to bring with you to your doctor if you are concerned about having IBS yourself. Hi again and welcome back to my channel. My name is Didi and I'm a registered dietitian with Didititian.com. Thank you for joining me for the first episode of my series, Gut Time. God, I love a gut pun. Never mind. In this video series, we will explore all things gut, starting with a journey into the causes and symptoms of IBS, followed by some exploration into maybe how to manage your IBS with your diet. As some of you know, I myself was diagnosed with irritable bowel syndrome several years ago, and finally my symptoms started piecing together. My first memories of IBS type symptoms were during my school years. I was always terrified of feeling hungry during school hours, and I needed to be prepared to the max when it came to school lunches and snacks, as any change in my regular pattern left me in a rather awkward position. My tummy would gurgle loudly, and it would make these odd high-pitched noises that were so loud you could hear them across the classroom. I would get very bloated and needed regular toilet trips. And as I approached my late teens, I started applying for after-school jobs, and without fail, the nervous minutes before a job interview often included urgent toilet trips and more embarrassing tummy noises. Then school presentations started having a similar effect, and I often felt nauseous. I was afraid to join in with gym classes at times because my tummy was so bloated and crampy. I felt awkward and I felt embarrassed, and I was mostly just confused. But time went on and these symptoms became just another part of my life. I felt that I had to accept that my tummy and I would just not be friends. So year 1 in dietetic college, and I was keen to clean up my diet. I thought that maybe simply eating healthier would be my magical cure for crampy bloating. I started eating high fibre breakfast cereals and upped my veggie game. I snacked on large portions of fruit, but lo and behold, my abdomen ballooned more than ever. I had days that I simply didn't want to leave the house for fear of tummy noises outvoicing me in the college lecture room. So by second year of college, I had managed to gather my courage and speak to my doctor about my concerns. My doctor discussed my symptoms with me, and I was sent for a blood test to rule out celiac disease. I was also referred to a gut specialist to rule out any other problems. Just a side note here, I did have my gallbladder removed when I was 19, so the doctor was concerned that perhaps there was some scar tissue causing my problems after surgery. So I had my scan at the hospital, and the specialist gut doctor there was thankfully able to rule out any problems with my intestines that may have been causing the bloating. So with my results in hand, I headed back to my doctor, and at this stage I did feel quite lost. My blood tests showed there was nothing wrong with me, and my gut specialist in the hospital found no problems with my scan. But if there was nothing wrong with me, why was I so miserable? So my doctor discussed my symptoms further, and that was the day that she told me I probably had irritable bowel syndrome. And with that diagnosis, I was sent on my way. I was told there was just no cure. I was given a tablet that I would have to take if my bloating ever got bad, but that was it. So cue third year of college, and I was busy beyond belief, studying, presentations, weekend jobs and dietetic work placements, and I had parked the idea that my gut would ever feel better. And I was really too busy to delve into what role my diet could play on these symptoms. So yes, I do have first-hand experience of how difficult it can be to take charge of your health when life gets busy. Then, towards the end of third year in college, we finally started learning about the role of nutrition in digestive health, and at last, a 1-hour lecture on irritable bowel syndrome changed my life forever. If only I had known all those years ago how much of an effect that diet really does play on our IBS symptoms. And not just diet actually, but our lifestyle, our exercise levels and our mood. So now I manage my IBS mostly through diet, exercise and meditation. And I do occasionally require a tablet to manage the cramps, especially if I've chosen to eat a food that I know might make me bloated. But overall my symptoms are quite well controlled, and they no longer really affect my social life. So today, let's take a look at those first stages of the IBS journey, from learning all about what IBS really is, through to maybe looking at how you could be diagnosed. First, let's clarify a little about what irritable bowel syndrome is. So IBS is a term used to describe a variety of gut symptoms. It is a disorder that interferes with the normal functioning of the large bowel, and it is thought to affect 10 to 20% of the population. It's twice as common in women than it is in men. While symptoms of IBS can change daily and over time, They may include things like changes in your bowel habits, such as constipation or diarrhea. Sometimes the abdominal pain or discomfort goes away after you move your bowel, or you may find that your bowel habit and stool consistency is different when you have abdominal pain. Occasionally, you might also pass mucus from your rectum. Pain or discomfort in your abdomen is another symptom, as well as bloating, tension, and a hardness in your abdomen. You may have a feeling that your symptoms are worse after you eat, and often you may find that the place where you feel the pain or discomfort in your abdomen might change location. You might also find that you have symptoms such as backaches, tiredness, bladder problems, or nausea. So what causes IBS? Well, the exact cause of IBS isn't known. However, it's speculated that people may have one or more of the following factors. Firstly, some people may have gut bacteria that cause more bloating than others. The bacteria that live in our gut are called microflora, and this microflora differs between person to person. It is perfectly normal to have bacteria living in our gut, and actually it's very necessary to have healthier bacteria there, as they help us to digest our food and can keep infections at bay. Now, the types of bacteria that live in our gut are unique to us, and they can change day to day. They are affected by the food we eat and the place where we live. They can also be affected by some medications, such as antibiotics. Some people have a microflora that makes them more prone to IBS, meaning that the types of bacteria that live in their gut might create more gas than for other people. So another thing that may cause IBS is how strong the contractions of the lining of our gut is. Our intestines have a lining of muscle that contracts to help us move food through our gut, and for some people these contractions may be harder than for others. Now, if the contractions are stronger or last longer than usual, they can cause the crampy feeling you get with IBS, and it can lead to gas, diarrhea, and bloating. However, for other people, the contractions may be weak and can cause your food to move more slowly through the gut, and this then can cause bloating and constipation as well. Inflammation in our gut can also contribute to IBS, and some people have a higher level of immune cells in their intestines. This has been linked to increased pain and diarrhea. For many people with IBS, their symptoms get worse when they are nervous or stressed, and it's unclear exactly how stress is linked to symptoms, but it's likely related to the hormones involved and our response of our nervous system. Also, some people are more sensitive to the feeling you get when your intestines stretch from gas or stools moving through the gut, and this can be because of an abnormality in the nerve system in your gut. When your gut and your brain are not communicating properly and signals between them are not coordinated correctly, you can experience more pain and a change in bowel habits. Another factor that may be causing some of those IBS symptoms are just that some foods you eat can cause more gas to be produced in your intestines than other foods. And if you are more sensitive to the feeling of bloating, this can trigger IBS symptoms. Now, women are more likely to have IBS than men, and sometimes symptoms might get worse when you have your period. Therefore, there is likely also a link between the hormone levels and IBS. And for some, a bad tummy bug caused by bacteria or a virus may lead to you developing IBS. In order to be diagnosed with IBS, your doctor will discuss your symptoms with you. Usually, a doctor will first ask if you have experienced a change in bowel habit, pain or discomfort in your abdomen, and a bloated feeling for the past 6 months. If you have, then your doctor should consider IBS as a possible cause for these symptoms. In order to formally diagnose you, you need to have some specific symptoms. So firstly, you need to have either abdominal pain or discomfort that goes away after passing a bowel motion, or pain and discomfort at the same time as having a change in bowel habit. You then also need to have 2 of the following. So a change in how you move your bowel, for example, needing to strain or a feeling of urgency to move your bowel. Bloating or tension or hardness in your abdomen. A feeling that your symptoms are worse after you eat, and passing mucus from your rectum. Now, before true diagnosis is made, your doctor will need to rule out any other problems that may be causing your symptoms. This will include a blood test to check for anemia and levels of inflammation. A blood test is also used to check that you don't have a gut disorder called celiac disease. If your doctor thinks it's needed, he may send you for a scan or ask for a stool sample, but this is not as common as needing a blood test. Your doctor should also ask if you've noticed any unintentional weight loss. He should check also if you've noticed any bleeding from your rectum, and ask if you've had any family members who have had bowel or ovarian cancer. So at the end of the video, I will give you a list of questions that you might want to ask your doctor if you are concerned about bloating and bowel changes. You can find a written checklist of this on my webpage, which I've linked in the description box below. Once you have been diagnosed with IBS, there are several things that can be done to help you improve your symptoms. Today, I have divided these into 3 key aspects: lifestyle, diet, and pills. Firstly, finding ways to deal with nerves and stress may help you to ease your IBS symptoms. Counselling, cognitive behavioural therapy, hypnotherapy, and relaxation exercise, such as mindfulness, have all been used to help reduce symptoms associated with irritable bowel syndrome. Yoga is also shown to have a positive effect on IBS. In general, it's recommended to just try to gradually increase your physical activity levels to help both your body and your mind to become healthier. Next, our diet can greatly influence our IBS symptoms, and I will cover some of the surprising ways you can help manage your IBS through diet in my next video. I'll post a link for this video in the description below once it comes out. So the dietary strategies recommended to start with include some small and simple changes to your diet. The next step would be to avoid certain foods that are known to cause gas for many people. And then there are some specific diets, such as the low FODMAP diet, that can be tried if all other dietary strategies are not relieving your symptoms enough. I'll also make a video about the low FODMAP diet over the next few weeks. For many people, diet and lifestyle changes are enough to help reduce IBS symptoms. However, based on your symptoms, your doctor might also recommend for you to try some meds. And these include laxatives, probiotics, antibiotics, maybe some fibre supplements, anti-spasm medication, anti-diarrheal medication, pain relief, and antidepressive medication. Now, you should continue to follow your doctor and dietitian's lifestyle and dietary advice while taking these medication. If you are concerned about your bowel habits or possible IBS symptoms, you can visit your doctor. And when you go to your doctor, it might be useful to have some information prepared in advance. Consider keeping track of your bowel habits. In a little diary, keep track of the date and the time that you move your bowels. You can use a chart called the Bristol Stools chart to describe your stool, and you can see a picture of it here. But you can also find a picture of it that you can print out on my website, so there's again a link in the description box below. The Bristol Stool Scale assigns a number to the type of bowel motion you're having, from a type 1 for a very hard stool to a type 7 for a very loose stool. So in your diary, write the date and time you moved your bowel, and also write down the type number as well, because this can help your doctor to assess your symptoms. Keeping a symptom diary in general would be useful, and this would mean you write down each day if you have any gut symptoms, and maybe try and delve a little deeper and describe those symptoms in your diary when you do have them. Consider asking family members as well if they have any gut symptoms or conditions, because irritable bowel syndrome and other gut conditions may be genetic, so it'll be useful for your doctor to know of any family history of these conditions. When you are at the doctor, feel free to ask questions about what he or she is telling you. I have a useful list of questions on my website, so find a link for that in the description below. During your first visit, it may be useful to ask for more information about IBS. Ask for more information maybe about the tests your doctor is recommending, and don't be afraid to ask when you can expect the test results back. If your doctor is referring you to a specialist, ask for more information about why you're being referred. If your doctor has diagnosed you with IBS, you can ask him or her for information about diet and lifestyle changes which they may recommend. If they suggest any medication, ask how these meds may help you, and ask if there's any negative effects. Maybe ask your doctor if he or she recommends for you to come back for a follow-up appointment, and if so, when that should be. So in today's video, we discussed what IBS is and what symptoms you may experience. We looked at potential causes for IBS and reviewed some treatments that your doctor may suggest. I hope you found the video useful, and feel free to forward it on to friends and family or share on social media to raise awareness about this common condition. In the meantime, please like the video and subscribe to my channel for more videos like this. And join me on my Facebook page, Didititian RD, where I will be keeping the discussion going about IBS over the next few weeks. Thanks so much. Bye.